everybody. All right, Dr. Ruth Roberts, we're here together to talk poop.
Woohoo! The most exciting topic in the universe, especially when it's exploding out of your poor dog's behind.
I know. I'm going to share the video on a couple things, but yeah. Oh, look at that. You can hear me again. So, how is everyone doing today? I hope they're doing good. I think that the biggest reason that I wanted to do this is because at my stores, this is, of course, one of the number one topics that I have people come in and asking, about. My dog has diarrhea, or my dog just came back from the vet from having diarrhea. They don't know what it caused, and 9 times out of 10, they're given this prescription drug, which I can never say right. Metronidazole.
Yeah.
Metronidazole. And what's crazy about this is that this is what happened to me long, long ago with my first miniature schnauzer, where she was 7 years old and all of a sudden just had diarrhea all the time and was throwing up all the time. And that began my spiral downward because I went to my conventional vet, who I also was following all of their instructions on feeding them the pedigree kibble and over vaccinating, and I did everything, flea and tick. I did everything wrong. So I feel like I need to say this because I think people think that I'm judging them if they haven't, figured it out yet. And I am not. I am out here to scream it from the rooftops that I learned the mistakes I made, and now I know better. But my dog was prescribed this medication, and it makes, I look back on it now and it makes no sense to me whatsoever, because when we have diarrhea or gut upset, we don't immediately turn and take an antibiotic. So why is that happening with our dogs? Why does this, besides the fact that a conventional vet is not trained about diet and nutrition, and this may be their only go-to, why is this so overprescribed for our dogs for diarrhea?
So I'll tell you 2 things. Number one is that here's the way it used to happen, and I think people are much better educated now. But let's say back in the good old days, in about 1993, you coming into my office with your dog has horrible, awful, dreadful diarrhea. And if I said to you, just feed some fiber foods and things like that, and things will be better in a couple of days. The next day, you call me screaming because your carpet is destroyed. And I'm not kidding you. This is, honest to God, one of the biggest reasons why veterinarians just started handing out metronidazole like candy.
Wow.
And right? Because there's been a huge shift, like in 90s, how people treated their dogs versus 2021, huge difference. We were just starting to bring pets into the house. So now it's just become rote, and our veterinarians, we've turned off our thinking caps by and large. And that's just so tragic. And you're right, metronidazole can absolutely destroy everything if you're not carefully repopulating the gut.
Well, we even have studies now. When I figured it all out, what was going on with my dog, the problem is that it will stop diarrhea. Sometimes it'll cause it to happen again, but there's now research studies out that are proving the damage that this drug does to animals' guts and humans. There's human ones also, because this is also a human drug, I guess.
Well, exactly. And to give frame of reference, I've had C. diff 3 times, which is horrible.
So
3
that's
times.
Wow. So that's something that you went through?
Yes. And I've had to take metronidazole 3 times. And to be honest, I'm grateful that it worked and it cleared it each time. Now, that still means I had a lot of work to do afterwards.
So the problem is that we need to determine whether the diarrhea is caused by a bad bacteria in their gut in the first place before we give this to our dogs. And if we do, we need to be prepared to rebuild their gut.
Exactly.
In the long run.
Indiscriminate use is the problem.
Right. And long. I mean, there's dogs that are prescribed to stay on it forever because they can never figure out the gut issue, which
Right.
I think is insane, which is a problem with a lot of these pharmaceutical drugs, is that they're only supposed to be used temporarily to fix or stop whatever the issue is so that they can get fixed, not
Yes.
to just keep it suppressed and, out of sight, out of mind.
Yeah, and indiscriminate use is the reason that so many cases of C. diff and other bugs are now antibiotic resistant.
Mm-hmm.
Yeah.
That is very true. I just had this argument with someone. They were like, oh, well, she's immune suppressed because she got MRSA. And I said, well, she got MRSA because she overused antibiotics. So let's not forget about where that happened.
Yeah.
And the antibiotic isn't going to fix everything. We should figure out whether the antibiotic should be used at all because it can cause so much damage.
Exactly.
So instead of, I always say this when you're on, one of my favorite things about you is that you empower the pet parent. And so we want to talk about your dog's going to get diarrhea. We all get diarrhea at some point. And we need to know, when is it that we go to the vet? And then what can we do at home? So I know some of the first things that also make me want to pull my hair out is people go, well, I've been feeding her chicken and rice. What's the problem with feeding chicken and rice?
Well, I think it's more of an issue of the chicken than anything else. It is blander. So I think the first thing to do, and this is what we all are afraid to do, is actually not feed anything.
Don't feed them at all.
Don't put anything in there. And then it won't come back out. Yeah.
And a lot of times when you put whatever it is down that special, they're not going to eat it. And that's because they understand that their gut needs to heal.
Exactly. Exactly.
I remember learning long ago about the little, and of course I don't know the names of anything, but the little hairs inside our intestines, and that if we're sick, that we've wiped them away, and if we give it some time to let them grow back again and absorb the food, then we're all good again. But we've got to let the gut heal. Go ahead. Yeah. You can tell us.
Exactly. Yeah. So the little, and it's actually, they're not hairs. What they are, the little villi, the little finger-like projections, are aligned with enterocytes. Those are the intestinal cells. And when you have diarrhea or something that creates an enterotoxin, a poison to the gut, they get stripped off. And yes, you need to. So basically, there's raw stuff in there, and so you got to let it heal.
Exactly. So when is it that a pet parent should be alarmed by the diarrhea and talk to their vet?
So a good rule of thumb is, if you see a little bit of blood, a little bit of mucus, it's okay. Things are changing in there. Things are healing. When there is a just straight frank blood, that is a problem. And that's really when we're looking at hemorrhagic gastroenteritis. That's the $10 word that usually gets thrown out. And
I think that the biggest tip that I love to give pet parents is look at how your dog is behaving. If they're lethargic and not feeling good and not drinking water and just won't get up, that's a bad sign and we want to take them in. If they're acting normal, I mean, I feel like Odie, my 14-year-old, is the diarrhea king, man. It's like, I'm going to have it once a week. There's going to be diarrhea for one reason or another. Don't know why, it just happens. Maybe it's old age. But yeah, he's bouncing around and feeling good and drinking and doing everything that he normally does. So I know not to be alarmed about it anymore. But that, I think, is the biggest thing, is to check their behavior. And if it is something that they are, it is time to go to the vet, what should they do? What should they ask for?
I think there's the other thing you said that's absolutely key is, are they still drinking? If they're not drinking, that becomes an emergency. If they're still losing fluid, that's absolutely time to go.
Or they're drinking and they're throwing up. They're also throwing up the water, meaning they're not able to keep anything down.
Exactly. And that's it. I mean, if they're vomiting, then that's time to go. So, and again, withhold water, all of those things. There's a download that I've got, and I think that's part of how you and I met, called When Not to Go to the ER Vet, that kind of goes through each of these situations. So,
awesome.
Your email us and we'll get that out to you. So what you want to do is this. I mean, if your dog is truly sick to the point where there is just flat, frank blood coming out, this is really kind of when it's appropriate for metronidazole. But the thing is that you need to watch what the dose is. A lot of times, they're sort of the old dose when I finished school in 1990 was 15 milligrams per kilogram, and now it's 7.5 milligrams per kilogram. And so that's the thing, is that there are studies that the higher the dose, the longer it goes, the more disruption to the gut microbiome.
Wow.
So, yeah. And so, frankly, at this point, a fecal test is going to be completely useless because most of what's been in the gut has been blown out. And that includes any intestinal parasite eggs, things of that nature. If this is where you may need to ask for some subcutaneous fluids if your dog is super dry, or sometimes even intravenous fluids, sometimes also something to help with nausea and or vomiting if vomiting is there as well. So there's a couple of things. If your dog has not had any type of dewormer and it's been exposed in a situation where, like a big kennel or something like that, where it's possible it may have picked up some intestinal parasites, it may also...
It's important to kind of take a step back and go, okay, where was my dog? What could they been exposed to? What
exactly.
did I feed them last? I mean, that's the first thing we do is we go, what did I last eat? So, making sure that maybe something's not wrong with the food, that you didn't give them a new treat. And then, of course, was there a kennel situation? Did you go to a new park? Yeah, all those things are kind of so that you can give the vet information in case there is a clue. Is there something that they can do to find out whether it is a bacteria situation versus, I don't know, what else could it be?
Yeah. So, I mean, you're right. I mean, and this is it. You got to think through everything so that you know kind of what's most likely to have caused this. As far as bacteria goes, so the two main categories we think of with diarrhea are parasites, so hookworms, roundworms, that kind of stuff. That's super unusual. Whipworms are more common in the Southeast. So that's a fecal test, and most veterinarians stop there. There's something called a fecal PCR test, and that actually tests for the DNA of the bacteria, things like Campylobacter, C. diff, E. coli, that actually produces enterotoxins, not the good kind of E. coli. So there are some additional tests you can do, but the vast majority of these guys is stress, change in food, things of that nature.
So a dog could be pooping blood just because they're stressed out.
Absolutely. And I mean, you've seen this. That's the vast majority of the start of cases of this HGE or hemorrhagic gastroenteritis is moving, stress, because the owner's out of town, it's a new situation, things of that nature.
So keep that in mind, guys, that, this is something that can just be caused by stress and anxiety.
Yes.
Or could be something that they ate real bad, or
exacto,
a blockage. I think not. Would you say if they're barfing and diarrhea and barfing everything, including water, that 9 times out of 10 it's a blockage, and that's when you want to make sure you get there? No.
9 times out of 10, it's just going to be some awful form of gastroenteritis that's, just like us, right? Sometimes if you get a bug, you cleaned out one end, sometimes it's both ends. But yeah, an obstruction is pretty unusual. Unless you have a Labrador, and then you have to be more suspect.
Yes, I know. Yeah. Or a husky, that I feel like huskies get everything in their mouth and eat it and get the blockage. Yeah. So if the dog does have to go on the Metro drug, or not, I mean, if we're going to the vet now and that's where we're at and we have to do that, you said the dosing is important.
The dosing that's important. Yeah. And then the other thing, all antibiotics should be used 1 to 2 days past cessation of symptoms. But we sort of say, oh no, take it for 2 weeks or 3 weeks or 6 weeks or, whatever it is. And there are situations where that's appropriate, but the majority of the time, no.
So how long would you say they should take the
Usually with metronidazole, I mean, it's like a miracle in a bottle. 2 days and the symptoms are gone. So then I would consider taking it 1 to 2 additional days past the end of symptoms.
So if this was my dog, this would be the last resort. This would
Yes.
be the absolute last thing I would do, especially most of my dogs are seniors or geriatric. So the last thing I want to do is mess up their microbiome that I've worked so hard to build and
Amen.
keep it that way.
Yeah.
I often will turn to natural remedies. So I haven't been to a vet for, diarrhea, I don't think ever, since my, experience, gosh, over 25 years ago now.
Right on.
So what are some things, like, I know the things that I do. I try to figure out what the heck happened and where it is, but I do have go-tos that the moment I see diarrhea, I will go to, because they're all natural and I know they're not going to cause any harm and they're not going to mess up the microbiome. So
right.
Some of the things are like Dr. Harvey's Runs Be Done, which, is a mixture of some all natural herbs and pumpkin, or Amber's Naturals Digestive Rescue. And I know that Mega Mucosa is one of your favorite. Now and Diagel is another one. That these, I literally can give them to my dog, and by the end of the day, everything is pretty much back to normal. And then I know it's not anything. Do you find that that's your experience also?
Exactly. I mean, and especially when you're using, so if things are really bad, stop feeding for 24 hours or so. So, and then
you guys need to remember that even if they were out in like a wolf or a coyote, they're going to stop eating so that their gut can heal. So yes, stop feeding them. That, of course, we want them to have the water. What about some bone broth or goat's milk?
For me, I would leave off on those things because, again, we've got this denuded GI tract. And so anything we put in is going to go straight to the immune system.
Okay. So how long did you say we want to stop feeding them? For 24 hours?
Yeah, so for 24 hours, and then just kind of gauge. I mean, some dogs we have to feed sort of little bits here and there, but again, fiber things like the Runs Be Done, the Paxate I'm not familiar with, but simple stuff like a rice congee. So essentially super, super overcooked rice that's a porridge. Interestingly, the water from the rice helps to take nutrients back into the body. And then other things like boiled potatoes, boiled turnips, boiled sweet potatoes, pumpkin, all of those high fiber vegetables are going to suck up the water so that things start to slow down a little bit. Bentonite clay, activated charcoal, those are all going to help it adsorb some of the bad stuff in the gut.
So I saw those things. Those are like in powders. How do you give it to them?
So you can get the activated charcoal is usually in a capsule, so you can just kind of down the hatch. Bentonite clay you can find in powders most often. Sometimes you can get it in encapsulated product as well. Even though we're not wanting to feed a whole lot, if you put a small amount of bentonite clay in something that they just adore, like a little piece of sardine, just to get it down, that stuff sucks water up like crazy.
Yeah, I love it. I think it's great stuff too. It's awesome. So how do we, if we have had to give them the Metro, or we are trying to heal the gut, we want to give them some pre and probiotics. When they're on the Metro, does it destroy everything and we kind of have to rebuild? Or is it something that we just give them prebiotics to help feed the probiotic?
And this is an interesting problem because there's a lot of evidence that after antibiotics, probiotics may actually worsen the reinoculation of the gut. But if you give probiotics, so let's say you're giving the metronidazole twice a day, you give that in the morning, give probiotics with food 2 hours later, then at least you're going to kind of keep things rolling.
Oh, really? So it just won't turn around and kill it?
It will. It's going to clear it back out, but at least you're going to have something in there, some decoys, so to speak, if you will. Now, there's also evidence that the sporulated probiotics will actually sustain the gut microbiota
Okay,
even
so
in
what
the
did you say?
sporulated, and this is the thing that's
What does
different.
that mean?
Woo-woo. so essentially so essentially what these guys are, they're bacillus species or clostridium species, even though different species of bacteria can be good and bad. They have little shells on them that prevent the gut, the stomach, and the digestive enzymes in the small intestine from destroying them. And so they get down into the colon and open up kind of in time to help provide this structure so that the microbiome does not get annihilated by the antibiotics.
Wow, cool.
Yeah, yeah,
That is very cool. I love that. Um, I don't know if you know this, but we have mentioned it before, but there's actually research that shows how that drug can damage the gut and how long it takes them to repair. So this is, I think that I want to bring it up because it's not something that we can. Here's one of the research
yeah.
on it right now of how hard it is to get that gut microbiome back to functioning. And remember, that's where their immune system lives. So this is why it's so important and why we talk about it, because this one drug could ruin everything,
And
especially if you don't know better. Like I
right,
did.
and it's all antibiotics. And unfortunately, veterinary medicine and human medicine are passing out antibiotics left, right, and center, even though we know we are creating resistance issues.
It's a thing of the past. There's something out there now that we can do that we don't have to turn to them every single time. And then not only
Exactly.
that, the Fortiflora, which is the most prescribed probiotic after, if the conventional vet does offer a probiotic, 9 times out of 10 they're going to give this one, and this one is not a good choice because it's one strain. And is it even appropriate for a dog? Isn't it a human strain, the Fortiflora?
It is, well, and this is the thing. There's cross links between human and canine microflora, but it's useful to help control diarrhea, and that's it. It's not a really big component of the normal microbiota.
Got it. So you've got the antibiotic that's killing all the good and the bad, and then you got the Forta that's also controlling the diarrhea. So there's really nothing helping to rebuild the gut microbiome. So
Exactly.
This is why you guys have to kind of become poop experts, because you got to know what to go out there and what to try, so that if you get through this, that you can rebuild it, because you'll keep having problems. Now, I know another thing that vets do if there's a dog that has chronic diarrhea, which I know is a problem that a lot of people go through. They recommend a hydrolyzed protein, which I also understand is supposed to be used temporarily, but is, I feel like people are being prescribed the drug on a daily basis and these diets on a regular basis for the rest of their lives. What's the problem
Right.
with that?
Well, I mean, the hydrolyzed diet, the whole point of it is to get the protein and the food particles down to a size that the immune system won't recognize. The problem is it's made out of junk. I mean, it's still soy and corn. It's just in a form that the body is not reacting to so intensely. And
Yeah, I was
because
looking at the hydrolyzed proteins of all the the Hill Science and the Royal Canin, and I think there's a Blue Buffalo one, and how you're right, exactly right. I think one of them had a salmon protein, and the rest were all something else. So
yeah.
these are the they say they're for sensitive digestive. And yeah, there may be no diarrhea, but there's also no nutrition or real food in these either.
Right. And the big difference is the sensitive stomach diets, like the science diet that you have there. The reason it's sensitive stomach is they put a ton of cellulase in there, which is a paper fiber. And all it's doing is sucking up water so that it's not creating as much diarrhea.
So your
And there's a
carpet
few other
thinks that
bits.
your dog is not healthy.
Exactly. So we're
Right.
treating the carpet and not the dog.
Exactly. I like that. Put that on a shirt. So yes. So you got to understand, you're given an antibiotic, then you're given a probiotic that doesn't work, and a diet that doesn't work. And none of these things are going to help your dog. They may temporarily make nice firm poops come out, but they're not serving your dog's microbiome or immune system. And that's what we want to do.
Right.
Awesome. So what are some things that pet parents can do on a regular basis to kind of support the gut and keep it from, if it does get into something bad or issues happen, what is something that they can do on a regular basis to support the gut?
Well, I think one of the biggest things is rotate the food. I mean, if you're feeding the same thing day in and day out, and there's some level of leaky gut syndrome, you're going to create food sensitivities. And this is different. Notice sensitivities, not food allergies.
Right.
Because that is hugely different.
And people freak out when I tell them change up the proteins. They're like, "What? Yeah. No, but I finally found the one that doesn't irritate."
Right, and now you got to find 2 more.
Right, good. So 3.
Yeah,
so at least find 3 different proteins to vary. And if you're doing a raw brand, meaning you're buying it, then that's pretty easy to do to mix up those recipes. And of course, if you're cooking. And those of you that do or don't know, you are the author of the Crock-Pot Diet. So it would be the same thing, mix up the veggies and the proteins.
Exactly. Yeah. And so it depends, for my patients that have really, really severe gut issues, we're going to change that diet every 24 hours.
Wow.
For the average dog that's, fine and healthy, each batch, you want to have a different set of proteins, veggies, and starch sources.
I love that. See, this whole time I thought I was, a bad pet parent because I'm constantly going, oh God, what do I have in the freezer now? Okay, that'll work.
Yeah, exactly. No, you've been doing the right thing. And you know this, you did all the research.
Good. I'm glad. Yeah. Nothing has made my life easier than, 2 things. Switching to a fresh, raw diet has been the best. And, we've got some really old little dogs here, in our pack, and they have had diarrhea. Blanche, for instance, has had gut issues since I've known her. And we ended up doing a fecal transplant on her, which, I had already done on my Schnauzer, Odie, to kind of set it straight. Tell her, everybody watching, what the heck's a fecal transplant?
It's poop. And it's poop served one of 2 ways, if you will. So there are fresh fecal transplants, and actually Dr. Margot Roman has put together a bank, which is fabulous. Awesome. And then Animal Biome has fecal microbiome transplant pills, or poop pills, and they are freeze-dried. So it's amazing. I mean, there's tons and tons of research. Like, this is now, if I were to get C. diff again, this is what they would do first, is a fecal microbiome transplant, because it is curative. They don't relapse. It doesn't matter if the bug is, completely resistant to antibiotics or not. Same thing with dogs. The problem is that once you've got a disaster gut, it is so hard to get things turned around.
It is.
So, yeah. And I see that, in the human research, the lyophilized or freeze-dried products like the poop pills we just talked about, their efficacy is somewhere around 70%, which is astonishing, because we're talking about cured for life. Honestly, there are some rare cases where you may have to continue to use some of these, but for the vast majority of the time, it's a one and done deal. And then that's where a fresh or frozen product can be a little bit more advantageous if that's easy to do. It does require some sedation, because it's essentially an enema with this stool product that's been carefully curated, for lack of a better word, cleaned, derived from animals that have lived a very healthy lifestyle. They're eating clean, healthy diets, whatever that means to the bank person. They're vaccinated only just as needed, or sometimes not at all. So they're coming with very, very clean, healthy guts, and they're providing an amazing change for many pets.
Yeah, and this is, if you do have an old or geriatric dog that you feel like you've tried everything and you're still having issues, to me, this is the answer. This will reset their gut. We actually just did it again with Blanche and with Linda, Hernando's dogs. And it's great because you basically send in their poop. We did it with Animal Biome. We're huge fans of Dr. Margot Rowan. And you basically send in their poop and they send you a report telling you everything that's wrong, which I think we have, if Carter, you're still there, Carter, we have Blanche's report so we can show you what it looks like. But I have a question for you because this blows my mind, is how bad Blanche's report was. And both of these dogs are fed a raw food diet, a commercially, nutritionally balanced raw fed diet. Yeah. So we were shocked. Both of them were disasters. So what is that? Leaky gut? They're not absorbing the nutrients?
Absolutely. And so this is where I'm a little different. I mean, I've seen cooked diets, and there's kind of a difference between lightly cooked and cooked, be better for many pets in some cases. And in some cases, raw is better. And it's interesting.
And I have found, not to interrupt you, but I have found with, I have a small rescue. So a lot of the dogs I get are either sick or, seniors or geriatric. And I have gotten them where I have to change their diets as they get older. So that is absolutely true. As they get older, they sometimes can't tolerate the raw as much, and they prefer the lightly cooked, and it's much better. So I totally see that.
And I think that makes sense. I mean, we all know that our digestive enzymes don't work as well as we get older. Sometimes, well, that's a whole nother bag of wax, but sometimes a digestive enzyme supplement will be helpful, and sometimes it can backfire. So, sorry, we have excitement in the house.
I know. I don't know if you could hear mine coughing before.
Yeah, there's always background noise. So this is the thing. I think that, and especially for patients that have been sick for a very, very, very long time, I'm going to almost always recommend going with cooked food because essentially it is pre-digested.
Got it.
Yeah, but you're right. I mean,
helping them do the work so that their gut doesn't have to do so much work.
Exactly. And that's it. I mean, so you've got essentially healthy older dogs, but they still had ugly looking reports. And this is kind of, so you have to make make changes as needed.
And do you think that a fecal transplant is something that you can do more than once in their life if they get off again, or is it a one time and you're pretty much set? If you don't screw anything up.
If you don't screw anything up. So that's the kind of the thing. If something else hasn't changed, they haven't had some horrible health condition popped up because that's the thing too, is that we don't think about is that just the process of getting sick, whether that's cancer or heart disease or whatever, that's actually going to change your microbiota to some degree. Even if you haven't taken drugs or any, metronidazole or any of this other stuff. So I think you have to really watch your pet. And if I've got a couple of clients that have dogs with lymphangiectasia, and for two of those pets,
what is
that? That's really awful bad stuff. Sorry, I'm just throwing out the big words.
That's okay.
Essentially, it is a really horrible form of malabsorption. And what happens is the lymphatic ducts get swollen, and so things just aren't moving out of the gut. They can't absorb nutrients very well. It's awful, and it has killed a lot of pets. Thankfully, it's relatively rare. So I've had two clients where they use the fecal microbiome transplant pills on a regular basis. They cycle through it. Seriously, I think it's like 2 weeks on, 2 weeks off. And that's where things have been copacetic. But they're in a situation where things are really awful. I've had other, dogs where that didn't work so well. So I think it just depends. If you have a pet that has other chronic conditions, then probably it does make sense to use that on a regular basis.
And all of these things are, what helps so much our pets. But what I love is that CBD will also help. So along with all of these, especially for your older dogs that, don't have the digestive enzymes like they used to, or they're more sensitive as they get older, CBD is a great supplement to add to their diet because it's going to get rid of, as our nifty little graphic shows us, that we've got receptors throughout our entire GI tract, our pets do. And it really is great for getting rid of gut inflammation and supporting the gut, helping the gut heal. So if you do have, an incident where you think you've set the gut off, CBD with these other things and a fecal transplant basically can reset your entire dog.
Amen. And here's another thing that's interesting. Where fecal transplants have failed for some of my patients, what I've found that actually has been working is using a couple of products from Microbiome Labs. One is Mega Mucosa, which we talked about before, and that's got 4 amino acids that actually help to encourage the enterocytes to come back in and start to grow. It also helps to put that sort of matrix of goo that the good bugs love to live in back in order.
I love
and
it.
Yeah, it's been just astonishing.
We're not giving them their food back, giving their food back. We're giving them an environment that they like to live in, and then we're giving them all their friends that help them do their jobs.
Exactly. And then that's where those sporulated probiotics, the either Megaspore probiotic, which is the human product, or Phytospore for dogs, come in. Those spores actually get to the colon so they can do their work. And again, they're able to create this scaffolding where all of the other commensal organisms that we probably haven't identified a tenth of yet can come in and do their jobs. And then that's when, once that's sort of set up and rolling, then that's where it becomes, in my opinion, becomes important to add in prebiotics. So whether that's a specific product like the Terrabiota, the Phytosflora, there's a boatload of them out there.
If I remember also, I think the Terrabiota has some of the clay in it.
It may, and that's where that gets a little interesting. I don't like to really mix all those things together.
Okay, then
because
maybe it doesn't. They have another product. Maybe that's the one that has it in it then.
Yeah. And then chia seeds, flax seeds, these are super, super easy. The other thing that's interesting about flax is that if you soak it overnight, it creates this kind of mucousy, gross liquid. And that actually helps to replace the mucin layer in the gut too.
Awesome. I also remember reading that if you do suspect leaky gut, which of course leaky gut basically means what we were talking about, that they're not absorbing. There's an overgrowth or an undergrowth or not enough of the good bacteria in their gut. So they can't absorb the nutrients. I heard that bone broth is really good for this. Is this, do you agree? And is it something that you give them instead of an entire meal? Is it a meal replacement, or do you put it on top?
I think you have to really look at your pet, because the other thing that's interesting about bone broth is that it can create a fairly profound histaminic reaction as well. So again, see, is it helping or is it creating a problem?
And if you do have a dog that maybe is sensitive, do you go for a different protein? So like a bison or a turkey broth versus chicken?
It's actually the process of making the bone broth that creates the histamine release. So it's really, really weird. And unfortunately, I found out about this.
A fermented probably would be a better choice.
It may be. And again, you're going to have to try it. For most dogs that are super healthy, it's not going to be a big problem. These are more subtleties for patients that have had very chronic GI conditions.
Right. So, and that's kind of the dogs that we're talking about. Yeah. The dog, I feel like it's especially the little dogs.
Yes,
the little
they
dogs
are.
That, I always say, Blanche, which I think we have a picture of Blanche. Blanche is so far from a coyote or a wolf.
Yes.
That, I don't know what the heck her biologically appropriate diet would be, but, figuring that out has been a mission. So, but I'm glad that we have these options, which, you would never think fecal transplant for a dog, but that we have these options that we can rebuild it and do it, because I don't know about you, but the immune system is the most important and powerful tool that not only we have, but that our pets have. And if we can support that and keep that as healthy and operational, we're going to have old, happy dogs, right?
Exactly. And the other thing is it's not just the immune system. These are also, the microbiome is also modulating your inflammatory response. And so if your microbiome is whacked, your pain level is going to go up. If you have arthritis, your skin's going to get worse if you have skin disease. So whatever it is, the other key thing with leaky gut syndrome is that it means that the immune system gets exposed directly to things that it shouldn't. And that's really where a lot of this problem comes in.
Because it's leaking out of the gut and getting into the body or into the bloodstream?
Literally. So if we think back to the little villi, the little finger, and you've got some pictures there, underneath these villi is the gut-associated lymphatic tissue. This is where the gut immune system lives, or exactly the body's response is a more appropriate way to say it. So, there's your cells, but underneath the cells is where the active immune system lives. And so things get presented to the immune system and it decides, this is fine, we can let this go. This is a normal piece of well-digested food. Oh, this is evil and awful, and we have to attack it and create antibodies against it. And this is where food sensitivities start to come in. And then also it creates this huge amount of inflammatory molecules, which then go somewhere in the body that we don't want them to go.
Wow.
So it hits a target organ. Maybe that's the kidneys, maybe that's the skin, maybe that's the gut, really, and maybe it's the brain, maybe it's the joints. It's different for almost every patient.
Well, some things that our pet parents can do. I always, if I have a dog that maybe went through a gut upset, being able to give them that fasting and letting it heal. Trying these natural alternatives to see if we can stop it and get them back to normal. Is it important for us, if everything's going right, to give them a gut rest or a gut reset every once in a while?
I think so. I mean, there's a lot of evidence, and for us too, that intermittent fasting is a good thing.
I do that with my dogs. That's how I feed my dogs. But even intermittent fasting, like skipping a day or two without feeding them at all, or just giving them a goat's milk or a bone broth or something, is that something that's good for them to do every once in a while?
Yeah, I think so. And I think, again, you have to look at each individual animal. So for some animals that works great, for other dogs, not so much. But I think if you're going to go with fasting, you want to avoid things that will actually kick on the digestive process. So I think you could go like, here's a mostly fasting day and then sort of finish up with something like a bone broth or Answer's goat milk or something like that, just to get something in there to get things moving.
Not Answer's anymore.
No? They changed names, huh? Cure?
Yeah. Answer's is, Answer's still exists, but everyone who made Answer's what they are gone. So we no longer recommend anything Answer's. And
interesting.
The farmers have now started Cure, which we haven't tried yet, but it's going to be, they're the same farmers.
Cool.
And then there's a lot of good ones. You can go to your local farmer and find a raw goat's milk that's probably going to be great for them. But these are just two of our favorites, Bone and Company, and we're assuming Cure is going to be as good as the Answer's goat's milk used to be.
Yeah, and that's it. I mean, if you can find it locally, so much better, because that's going to be sort of the microbiome of your local area.
Exactly. Same thing with getting local honey, or if you've got a local provider who's making raw dog food. I always love if you can get some organs or maybe some bones for your dog. All that is great to get locally.
Yes.
We love that. I think that we've gone through everything that we wanted to cover. I just wanted to bring this on so that people knew that, this is one of I think the biggest mistakes we make as pet parents is, running to the vet going, stop the diarrhea. And the diarrhea isn't the end all. And I think this gave us a little bit more of an education, and to go in armed with questions. Yes. And what you don't want. And don't give my dog an antibiotic ever until I know that's the only thing that's going to help them, because it will wreck their gut. And if you have a dog that's older and battling other issues, it could be the thing that changes everything, from them recovering to them going and getting sicker. So
Yes.
thank you so much for talking poop with me
Always a pleasure.
and I think that, I don't know if you, of course, yes, you can go to drruthroberts.com where you have a store that has much of the things that we talked about, healing naturally. The crock pot diet is what we also, Dr. Ruth Roberts, created long, long ago. For those of you who are looking maybe for a diet that's a little easier that you can do at home. But I guess, Carter, is there a way to see if there's any questions or anything like that? I don't even know. I know we're live. Is there a way to see if we've got some questions, if anybody has got them? Oh, look at that. I think I see questions. Oh, hello, Wes. Hello, Florentina. Hi, Danny. Hi, Joseph. Hi, Hernando. Hi, Amy. I just found everybody's comments.
I know. I just saw them too. Hi, Susan McPherson. Good to see you.
Hi, Susan. Thank you, everyone. Awesome. How often? Look at that. We even answered the question without even knowing. Thank you, Wes. I read your mind on how often. Can dogs with lympha, do you see that one?
Lymphangiectasia. Eat a raw diet, Susan. I think that would be a recipe for disaster. And
that would be someone that you a disease that you would absolutely do a lightly cooked.
Yeah, I think that's going to be better. I mean, Susan actually has been battling this with her pup for a long time. Like I would, anything, trial a very small amount and see what happens. So make it an amount smaller that's going to create a potential disaster.
So do you think that there's a fear of those that are raw feeding that we're like, we know that's the best, so we don't want to go to lightly cooked, but a lightly cooked is better for a geriatric or senior or sick pet because we are helping them basically pre-digest it by cooking.
Right. And honestly too, I mean, I think that from my perspective, I think that cooked diet is a better way to go in general, just because it's easier for the majority of these guys to digest their food and to get away from problems. But again,
you see like a kind of timeline between this age and this age, raw, between this age, they hit 7. So between 7 and 10, we'll do lightly cooked, and then 10 on do.
I don't know. I literally see puppies come in at 6 months of age eating a raw diet with horrible gut issues, and then they go to cooked and they're fine. So this is it. I mean, I think exactly. And I think we have to really say it's not one size fits all. It's what's working best for your dog at this moment.
Good. So don't give up. If raw doesn't work, you can go to lightly cooked. There's also freeze dried and dehydrated. There's so many choices. We really do have. Actually, Carter, do we have the Good Food brand? Of course, we've got these are a couple of the brands that we like food. And of course, if you want to cook, we love the Crock-Pot book, which gives you some awesome recipes. And while he finds that, I'll see if there's any other questions from anybody. Yes. Oh, good. Marianne putting on her salves and mushrooms. Yes. We love mushrooms. I can't believe we didn't bring them up. My dogs, everyone in my family and my dogs get medicinal mushrooms every single day. I am huge on lion's mane right now because I just lost 2 geriatric dogs to dementia, which I was fighting cancer. I was keeping their microbiome, healthy, and I lost them to dementia. So lion's mane is great for the brain. These are all proved in research already. So I'm giving my geriatrics lots of that. And then, of course, Nina, who's got osteosarcoma, gets so much turkey tail. But reishi is another one that we love. Chaga is great for the gut. So anytime a dog maybe looks like they're having an issue with their gut, I'll throw some chaga in. I
Right
want
on.
to say that the Runsby Done, I know some of Dr. Harvey's blends have some medicinal mushrooms in them also. What
And
are some of your favorites?
I've got a great product we'll be having in the store probably in the next week that it has kind of everything you just mentioned at adequate doses to actually do something, do the right stuff.
Awesome.
So we're super psyched about that. That'll be called Mycopause, but
I love it.
Really psyched about that.
And
but yeah,
is it a tincture or a powder?
It is a powder inside of a capsule, so it's easy to, for tiny pets, you can break it open and dose it that way, or just give the whole capsule for larger breeds.
My favorite thing about mushrooms is that, when you put them in food, most of the time, besides reishi, but the dogs like them. They don't.
Yes.
They love the lion's mane. They don't. It doesn't even stop them.
Right.
But, we are also working on some formulations because a lot of these medicinal mushrooms are adaptogens and work really well with hemp, a full spectrum hemp extract and cannabis. So we're working on formulations also with the medicinal mushrooms because we love them. So yes, whoever brought up the mushrooms, I don't know who, but thank you. Yes, absolutely. We love mushrooms. So I would say chaga is the best for if you've got a gut issue.
It's one of them. It's one of the better ones, but I think a blend, because we're working at so many different levels within the immune system, is a better option. And I think, like as you said, turkey tail for cancer patients, things of that nature. Yeah, just good stuff.
And if you guys don't know, all of these things that we're saying, you can literally go on to and Google is turkey tail research on cancer, and it'll pop up. So I know you're the same way. We rarely will come on here and go, we recommend this if there's not research that has been done. And or, for instance, on cannabis, I've been using cannabis since 2016 on pets and have, done everything. By the way, just want to mention this really quick because I haven't talked to you in a couple weeks, but Nina is 14 months out from her diagnosis and has no metastasis in her body.
Right on.
So no chemo, no amputation, all natural, ketogenic diet, so many turkey tail mushrooms, and so
Amen.
much full spectrum hemp extract and THC that we give her at night. And Nina is thriving. She actually takes the horsies, which is pictured here, that has the turmeric and frankincense in it, instead of the dog, because it has so much more, it's much more potent than the dog one. But, I just love these all natural things that exist that are in our world. And we just need to learn about them, research them, and then put them to use because they work.
Amen.
Amen. So I'm very excited about that. She did injure her good leg, so we've got her on bed rest to keep that going. But she's turning 10 in September, and she's just got cancer right here. And that's it.
That's amazing. That is awesome. Hey, have you tried an CC loop for the good leg?
No, but what is that?
Oh, that is cool. So it's pulsed electromagnetic frequency.
Oh, we did sound wave.
Yeah,
it's like that.
It's a different modality, but it's super, super easy on. You just literally, we're using it for our older cat Pepe. Literally, actually, this is the loop right here. So this little thing, it's got an on-off button, and you just put it over the affected area. They make a bigger one too, but you just turn it on, hang out for 15 minutes. Yes, ma'am, you can.
Yay! But all right, I'm going to order one right now.
These are really awesome. Yeah.
Okay, cool. That's the biggest problem with her, is that she's a Doberman, and the getting in and out of the car, and it's one good leg with a torn tendon and the bad leg. So literally I have to catch her as she's jumping out and then getting in, because she was used to jumping in and out all the time.
Yeah. So, yeah. It's hard. It's so hard.
It is hard. So it's like, do I risk more damage? Do I keep her on bed rest? So I love I'm one of those people that if you're going to let me buy it, I'm going to buy it and I'm going to do it. I'm going to try it. I love this.
Check
I
it
love
out.
being
Yeah.
empowered. I love watching these things work. It's so awesome.
Yeah. And the awesome thing is because you can put it over here, it's far enough away from the cancer leg that you're not going to create an impact. So yeah, check it out. Yeah.
All right, Dr. Ruth, I don't know if we've got any more questions, but I feel like I've kept you on for a whole hour. So I know.
Good stuff.
Right. Especially since you thought it was gonna start in an hour from now because of time.
Yeah, time zone. I hate that. But hey,
well, you guys know how to get in touch with us if you have any other questions. You can also keep putting them. If you watch later and come up with a question, you can always put it on this feed and someone will get back to you. But thank you for joining us. Thank you, Dr. Ruth Roberts, for talking poop with us. I really appreciate it. And hopefully we've prevented some pet parents from running to the vet every time there's a little bit of ugly poop.
Amen. Yeah, you can take care of 90% at home.
90% at home. You heard it from the doctor, guys. That's so true. You can do it. You can take care of it. It's just a little bit of poop. Everyone gets diarrhea once in a while.
Yeah.
All right. And I just noticed my handle's wrong, Carter. It says angel. I'm no angel. Bye, everyone. Thank you. Take care.